Welcome, everyone. Thank you for coming to this, the first of our McLeese student debates. Today, we have four tremendous young debaters who are going to be tackling the question, be it resolved, I would rather get sick in the United States than in Canada. To thank all of you for coming, those of you who are joining us online, and certainly Mr. Willis McLeese and the McLeese family for making this possible. I'll get out of the way in just a moment. I'd just like to introduce and thank our four student debaters and those students who are helping out. Mr. Harris Kaufman for the proposition from Upper Canada College, his partner Nicole Ratty from Richmond Hill High School, Diane Schneer from Northern Secondary School, and Louis Fainer from Thornhill Secondary School. Our timekeeper is Nicola Parrish from Richmond Hill High School, and beside me, our moderator, Karthika Sathanandan, also from Richmond Hill High School. So without further ado, Karthika, our moderator, let's begin.
Hello, everyone. In the sport of debate, there are many styles. The one which you will be watching is the Canadian National Debate format. It consists of 4 constructed 8-minute speeches. Each member will deliver one of these speeches and be expected to bring new points and ideas into the round to further develop their argument. Every speaker after the first will also be expected to refute the ideas previously stated by the opposing side to prove them invalid, and then to proceed to state why their own arguments are more important to the resolution. Other than their speeches, speakers are only able to speak during points of information. A point of information, or POI, is offered when a member from the opposing team stands up, usually like this, during a speech with the intent of pointing out a flaw in this case. Since the speaker has the floor, they can accept or decline POIs as they choose. The debate will be concluded with a 4-minute summary speech delivered by the first speaker from each side. These speeches are to summarize the main themes and ideas brought forth in the round, as well as refute any outstanding ideas from the opposing team, but no new material is allowed. The general idea of a debate is to voice new and interesting perspectives about controversial topics, which helps broaden one's scope of thought. This unique sport of words helps build one's confidence, charisma, and creativity in developing ideas. The 4 upcoming speakers will show a variety of ways in which debaters use style and eloquence to prove their point. Please enjoy this show round. Now, without any further ado, I call this round to order. So the resolution before this House today is I'd rather get sick in the United States than Canada. Representing the proposition are its first speaker, Harris Kaufman, and second speaker, Nicole Ratty. Representing the opposition are its first speaker, Diane Schneer, and second speaker, Louis Fainer. I would like to sincerely welcome Mr. McLeese, Mr. Caldwell, Mr. Lawson, Ms. Bialystock, Mr. Abarbanel, and all the other guests. Each speaker will deliver an 8-minute constructive speech. Nicola will bang the desk after the first minute, and again with 1 minute remaining, to signal the time during which POIs may be raised. For each speaker, 15 minutes will be allowed. After each speech, I will immediately call upon the next debater to begin his or her address. There will be no points of order or points of privilege. Heckling is also prohibited. Are there any questions regarding the rules? Okay, so I now call upon the first.
Thank you. Ladies and gentlemen, imagine today that you were diagnosed with cancer. In Canada, you have to wait 4 weeks before you can even see a specialist doctor, and then an additional 4 weeks before you can begin treatment, which is double the maximum time that oncologists recommend if you actually want to get rid of your cancer. 8 weeks before you can even start to fight the disease, while it spreads throughout your body and you are helpless. In America, you can see a specialist doctor tomorrow and begin treatment before Friday, which is why today the side government is proposing the resolution that be it resolved that I would rather get sick in the United States than in Canada. On side government, I have 3 constructive points that I'm going to be bringing forward to the House today in my speech. First, I'm going to talk about the efficiency and how America simply has a more efficient system. Secondly, I'm going to talk about the hidden costs of the Canadian system. And thirdly, I'm going to talk about the value of choice in choosing whether you need medical insurance or not, like you can in the United States. But before I do that, I'd quickly like to define the terms. We define it pretty loosely. I would rather get sick in the United States than in Canada. We're pretty much saying that I would rather get sick as an American citizen in the United States than getting sick as a Canadian citizen in Canada. Now on to my first point about efficiency. The United States is largely efficient because it has a free market system where there's a profit incentive. there's competition, which leads to overall better service as hospitals try to compete and encourage patients to come to their hospital by offering a better service. Recently, in a ranking of the top hospitals in North America, the #1 Canadian hospital came 56th behind 55 American hospitals. In a world ranking of the top hospitals in the world, the United States had the top 25 for 25 hospitals. So we think it's quite clear off the bat, if you want to compare healthcare systems and you want to compare our best healthcare versus their best healthcare, the United States is much better in this regard. Furthermore, because doctors can make significantly more money in the United States, there's been a brain drain recently in Canada due to an exodus of doctors because after 8 years of studying, they rightly would like to earn a larger salary. And this in part has led to a huge general practitioner shortage in Canada where people can't really see their doctors. Because of the GP shortage, many people don't want to wait 3 weeks to see a doctor, so they're running to an emergency room when they have the tiniest little problem, and this further crowds emergency rooms. As well, we would argue that Canada's monopoly allows inefficiency as there's no accountability and there's no competition to promote the best hospitals and doctors and to isolate the worst. Recently in Canada, we've seen problems with cronyism as well, because a doctor who is your friend can help you in 2 days because no person directly pays them and they can pick and choose who they see. So, essentially, the wealthy and famous in Canada are able to get quick and effective care, while everyone who doesn't know a doctor or the head of cardiology at the Monk Center, they all have to wait in line. But those who are famous and wealthy and powerful can get quicker service before everyone else. Sure.
Wouldn't you agree that the same is true for the U.S., except more so? Because in the U.S., if you're wealthy, you can get it quickly. In the U.S., you can't get it at all. Wouldn't you say that's worse?
Well, no, because in the U.S., you can get healthcare if you have health insurance. And even if you don't, if you're in an emergency or any other situation, no hospital is able to refuse to treat you. They might charge you after if you don't have health insurance like you would expect they would because you're using their services, but no one has refused treatment in the United States. As well, America's profit incentive has led them to focus more on research and development, and internationally, America ranks first in medical innovation and breakthroughs. In fact, the top 5 U.S. hospitals conduct more clinical trials than all of the hospitals in every other developed country combined. They're also #1 in responsiveness, which measures how fast they are in treating something after a diagnosis. This is part of the reason they have a lower cancer mortality rate than in Canada, because they're much better at treating it once they diagnose it. It becomes really clear that the American healthcare system is superior when Canada's very own leaders, like Belinda Stronach, Danny Williams, and Paul Martin, extol the virtue of Canadian healthcare, praise its sacrosanct nature, and demand that it remain public, yet when they need medical treatment, they all opted for private clinics, as even they don't trust our system. They voted with their feet, as did the King of Jordan and countless other figures, because if you want the best treatment, you go to the United States. In life, you get what you pay for, and these people understand that we want the better service. It's our life. We live once. We're going to get the best service in the United States. There are also a lot of hidden costs that people don't realize in the Canadian system, and I'd like to quote Theo Caldwell himself, who said that Canada offers universal coverage, but not universal care. Because of the government's inefficiency and arbitrary cost-cutting, many medical requirements are not covered by the government. For example, if you break your leg, they will give you the cast, but the physiotherapy, the actual tough and expensive part of recovering, might come out of your own pocket. As well, if you don't work for a big company, you might not have a drug plan, which can be very costly. I recently went to the doctor and they told me that my spring medicine, my spring allergy medicine was $90, and because I'm not covered by a drug plan, I didn't buy it. A simple bottle of allergy medicine is $90. I can only imagine the cost of actually paying for some serious drugs, like for cancer treatment, antiretroviral drugs for AIDS patients, and I think, it's going to be extremely hard to afford that. There's also a double shock when it comes to the Canadian system, because Canadians don't budget they don't budget and they don't put away money thinking they're going to have to pay for medical costs because they think it's all covered by their tax money. Yet in fact it's not, and recently a study showed that 65% of Canadians have to pay some sort of extra cost. So they're getting hit twice, with their tax money and the extra cost of a drug plan or something like that later on.